Let's talk about eating disorders. And when we think of the eating disorders, what is essential is that both of the girls who have anorexia and bulimia have found ways to lose weight. And what are usually the common ways? They diet, they exercise, they abuse laxatives, they abuse diuretics, they purge, and many of them, of course, will have surgery. So now let's talk about the eating disorders themselves, anorexia and bulimia. What do we know about anorexia nervosa? We know that these are girls who basically are unable to maintain a normal body weight. That is, they typically lose more than 15 to 20% of what is considered ideal body weight. Not only have they lost the weight, but they have this fear and intense preoccupation with gaining more weight. They have what is called a body image disturbance, where they have an unrealistic self-evaluation as being overweight. So they perceive themselves as being overweight when actually they are still very, very thin. And also, they need to have amenorrhea for at least 3 or more cycles. There are 2 subtypes of eating disorders for the anorexic type. There is the restricting type, and those are the ones that do not binge or purge. And then you also have the binge purging type, which do engage in the classic binge purging behavior. And it's very surprising for a lot of people to learn that more than 50% of the girls who have anorexia also binge and purge. So I do not want you to focus on the behaviors that these girls do to determine whether or not they have anorexia or they have bulimia. What I want you to focus on is, let's go back to the previous slide, and that is the girls with anorexia have what's called body image disturbance. And one slide back, the girls with anorexia also have that great weight loss. So they've lost at least 15 to 20% loss of their ideal body weight. That, with the amenorrhea and the body image disturbance, is what is classical for the girls who have anorexia nervosa. Now, the risk factors for anorexia, they do think that it is genetic. So if it is genetics, you'll probably find a greater incidence among those that are monozygotic versus dizygotic twins. Many believe that the amenorrhea may actually precede the eating behavior. Now, as far as some psychological risk factors, the most important one is issues of control. These girls are tired of being controlled. They have issues with their family as well as issues with sexuality. And of course, society might play a role in this because there is a cultural emphasis on thinness. Anorexia occurs in about 0.5% of the population, definitely more girls than boys at approximately 10 to 1. The average age is about 17. The older the onset, the worse the prognoses. And of course, these girls usually have a lot of emotional stressors associated with the anorexia, particularly issues with independence. So what these girls tend to do is that they monitor everything that they eat. They limit their food intake. They prefer to eat alone because when they eat alone, they could limit the amount of food that they eat. And if they're forced to eat with other individuals, then they'll probably hide food all over the house to dispose of it later. They spend a lot of time collecting recipes and preparing food, but they do not do what most people that do that, and that is eat the food. So they have this image of collecting the recipes, preparing the food, but yet they do not eat the food. So their biggest concern is what they look like. So you'll see them weighing themselves repeatedly, looking at themselves in the mirror, and no matter what you tell them, they will always deny their emaciated condition. Some of the associated symptoms, of course, is that they are going to have a lot of interest in food-related activities. They could have some obsessive-compulsive symptoms. They could have some depressive symptoms. And of course, some individuals do recover after one episode, but remember that this is a disease that is very chronic and is a very long and unremitting course. One of the physical findings that you see in the girls who have anorexia is malnutrition. And when you do the physical exam, you'll see the evidence of the bradycardia, you'll find hypotension, you'll also find some peripheral edema, you'll find lanugo hair. Because they do purge, you'll find all the evidence of purging. You'll find the calluses and abrasions on the back of their hands and fingers. You'll find the cavities. You'll find the Mallory-Weiss tears. You'll find the parotid gland enlargement. And of course, medical conditions associated with their starvation and or purging. Now, what are the signs of malnutrition? You're going to have anemia, usually the normocytic, normochromic type. Their enzymes are going to be elevated, especially the liver enzymes. Their electrolytes are going to be abnormal, and what usually kills them is hypokalemia. That's what causes their death. Low hormone levels, so estrogen and testosterone is going to be affected. Sinus bradycardia, problems with the EEG, and of course, a reduced brain mass. So when the girls are purging, meaning the vomiting, what is it that you typically find? You're going to find the metabolic alkalosis, hypochloremia, hypokalemia, and of course, if they're abusing laxative, you're going to find metabolic acidosis. The initial treatment for these girls will always be their safety. Make sure that they're safe. Make sure that you correctly identify the electrolyte imbalances and fix them accordingly. You might have to put them in a hospital if these girls are starving themselves. You also would try behavioral therapy. For example, form contracts with them where they have to gain a pound a week. If not, you're going to put an NG tube in them. So there are certain things that you could do in order to help these girls. Family therapy is essential because remember, these are still adolescents. They are still in the family unit, and the family is also suffering from this as well. Antidepressants are used not so much for the symptoms of depression that some can have, but mostly to affect the side effects. And what are the biggest side effects of antidepressants is increased appetite. So that's what you hope these girls can get. And the differential diagnoses, of course, will be bulimia being the biggest one, medical problems that could cause weight loss, such as cancers, etc. Make sure they don't have depression. Make sure they don't have schizophrenia, OCD, or body dysmorphic disorder, which is different. Body dysmorphic disorder, if you remember, was the feeling that some part of your body was misshapen, abnormal, or defective.